And then can you walk me through just what an average journey for a person, a client that approaches you would be? And what is the most, I would say, like the most ideal outcome for your client base?
I take a lot of time at the beginning when I first meet someone to establish a target weight. And that I think is just based on I've been a liposuction surgeon for, gosh, almost 30 years. And so it was a normal practice for me to ask someone what's the most they've ever weighed and the least that they've ever weighed in their life, because there a lot of terms might be coming to me because they gained some weight. And I can look at them and say, well, I'm only going to maybe take 5 pounds of fat off of you. But if they're 15 pounds over what their normal weight is, there's something else that has to go on there. So I was used to having those conversations with the patient. And I think that that is critical. And I use it in a lot of different ways because I have them on medication until they get to the target weight. And then we start backing down. And then after the target weight, then I establish a success zone, which is generally about 25% of whatever weight they're going to lose. So if they're losing 20 pounds, then within 5 pounds, that kind of puts on, if they get to their target and then they gain 5 pounds, then that's kind of their emergency zone of, oh my God, I really need to make sure I'm not going to yo-yo. I need to, get back into my program or go back on medication if they've discontinued it. So I think that establishing that target weight is really critical, and it's different for everybody.
I would say we do things really differently. A target weight can be really tough. If we were showing pictures right now, I would pull up Kelly's pictures where she weighs 145 pounds and is very unhappy with her body, and 145 pounds where she is in a bikini with a six pack. There's a lot of variability with what you weigh and what you actually look like. And that goes back to the nutrition that's happening while you're on the medication. So if you're eating 1,000 calories a day of Big Macs and candy while you're on the medication, you're probably going to get to the 145 pounds where Kelly was not happy with her body. But if you are following a good protocol, you're eating enough protein, you're lifting weights, you're focusing on building muscle, which will help with your metabolism, but also change the shape of your body, you would be really happy at 145 pounds looking like her in the bikini. So I think there's a lot of variability with that. We work a lot more with body measurements, progress photos, how clothes are fitting. We obviously track weight. That's important, but it's just one data point that goes in the whole bigger picture. And I'll let Kelly talk a little bit more about just sort of the process of working with us, which you asked about, Esther.